Hi, everyone. Great to have all of you on board. It's been a long few days, but I'm sure well worth it. The hike conference has been an amazing experience, certainly for me, with lots of very different things, but I think quite importantly, the attention being paid to primary health care. Well, join us in this panel, which is going to look at from attention to action on health systems, driving accountability for PHC in the wake of COVID. This panel is sponsored by the Primary Healthcare Performance Initiatives, which is PHCPI, in partnership with the Allies Improving Primary Healthcare. And we're ever so grateful for AHAG and AMREF to provide us this platform to talk about primary healthcare so extensively. As you know, the COVID pandemic has literally challenged us all. And I think it's also shed light on the difficulties we face. And primary health care is, in fact, one of those places where we are struggling. And in fact, the opportunity is there with the renewed focus of all of society on healthcare to say primary healthcare matters. So how do we go about this? And we're going to explore in this session how in-country advocates, that's yourself, can in fact leverage the attention on healthcare delivery across the globe to hold governments to account for the high quality primary healthcare systems that we all expect. So what is the format going to be? It's going to be a 15-minute roundtable conversation. We're going to have a 25-minute teach-in and then a brief Q&A if time allows. So firstly, let me introduce myself. My name is Shabir Musa. I'm a professor in family medicine in Johannesburg, Wits University. I'm also the president of the Africa region of WONCA, which is the World Organization of Family Doctors, and also the convener or the coordinator of the African Forum for Primary Health Care, where we are trying to bring together different members of the primary health care team together, that's nurses, clinical officers, doctors, etc., and community health workers, to see how we can together advocate for high quality primary health care in UHC systems. Well, in terms of advancing the problems or the issues of primary health care, I've been also fortunate to be part of the HIGE Commission, for which you must have heard of in this conference. And as one of those 11 commissioners, it was quite heartening to see the priority with which primary health care featured in the discussions and the need for us to have primary health care. But it was quite surprising, even in that discussion, that despite it being a priority, when eventually the report was being crafted, people started off with higher level systems and then went down. And to me, that was unfortunate. And in part of the revision of the report, the executive summary that you've seen, we actually shifted the attention and say, really, communities are first, then we talk about primary healthcare systems, and then all the other things with finance being way down the line. So I think this is our take on primary healthcare, that it really deserves a lot of attention. So I want to briefly introduce, and before I even go into that, I want to basically just mention some house rules so that you can be able to engage better. So after I do a panel introduction, we're going to go through a minute of explaining. So basically the Q&A, I want you to look down and see the opportunity to answer questions. Please feel free to in fact put your questions out there. If you have any comments or any other observations, not a question, please feel free, even introducing yourself, please use the chat function for that. There will shortly be a poll, which will be an opportunity for you to share some of your thoughts around the questions that have been related. So please wait for that, and please do join into that in that poll. And then lastly, the opportunity for translation. If you have not understood by now that the little globe, which is at the bottom of your screen, that says interpretation, is there for translation. So even if someone speaks French, go click there and you will get an English translation. So French is also the other language that you can get our conversation translated into. So please make yourself comfortable. Let me first introduce the panelists, and I'm going to be very brief. I'll later bring that up as I go along. But there are a few people that I think you need to know are very important in this discussion. Yacine is basically, let me just quickly get to her details. Let me start with Esther Agbon. She's a public health practitioner, but also senior health financing advisor and deputy country lead for Evidence for Action. And she works extensively in Nigeria around maternal and newborn health, looking at developing evidence that reaches decision makers. So very strong activist for advocacy. Yacine Djibo, also another activist in the advocacy space, is the founder and president of SpeakUp Africa. Yacine's founded it, and I think what she's dedicated to is to empower African leaders and citizens to save and improve lives, and to do that, by advocacy and communication policy advocacy. Youssoupha Ndiaye is a director for planning, research, and statistics at the Ministry of Health and Social Action in Senegal. And in Senegal, he's quite an extensive advocate for primary health care, doing a work on the national extended program of immunization, and highly committed to health system development strategies. Our last but not least speaker is Belinda Nimaku, who's actually the public health practitioner, but she also occupied a role as a director formerly in the Ghana Health Service on information monitoring and evaluation. And she's also a strong activist for translating evidence to strengthen health systems, especially primary health care in Ghana. So to all our speakers, all our panelists, welcome. Thank you very much for joining us this afternoon. I'm going to start off with this, opening question, and then we'll go into a bit more detail after a poll is set up. So let me just ask for each of you to just have 2 or 3 minutes to respond on how has primary health care played a role in equitable COVID response and recovery, and what opportunities do you see to leverage primary health care to ensure people's healthcare needs are met? So perhaps, Yacine, if you can start, and then we can go through the group. Thank you.
Thank you very much. So maybe just to respond to your questions, I think the COVID-19 pandemic has really shown us how essential it was to protect and strengthen primary health care, and really look at ways in which we could ensure that a lot of the progress that we had accomplished working against other diseases and development issues were not compromised. And so as we were looking at the work we were doing across West Africa and Francophone countries, essentially, we were able to see a great disparity amongst the different countries. But one thing we noted was that countries that had strong primary healthcare systems were able to continue to deliver essential health services to those that needed it most during the pandemic. And, I'm sure we'll hear more from Youssoupha later around the case of Senegal, but in Senegal, where we're headquartered, we've seen also how having a strong network of community health workers already practicing integrated community case management, for example, was really instrumental in ensuring that they were able to support communities, not only in being able to identify signs of COVID-19, but also using hand washing practices and good hygiene behaviors. And so some of the key drivers we've seen is really how important it is to have strong country leadership. And we've also seen that leadership at the head of state level, but also, going down with the municipalities and at community level. And as you mentioned in your introductory remarks, I think community engagement and participation in building trust and really being part of the response was instrumental in the work that was done. I think one other key element that we noted was really the need for a coordinated national health response. And really, we've seen how in many of these countries, the government brought together key stakeholders across sectors to really come together and bring a response. And I think as we look at opportunities in the future to be able to leverage, one of them will be to champion this multi-sector approach and really ensuring that we're working in an integrated fashion to be able to have a holistic response. I think it will also be important to really look at the ways in which health issues complement each other and how they all depend on having strong health systems and really being able to make that case. And maybe two additional elements, I think, is really the importance of data and having strong data systems and really being able to ensure that those are improved and being able to use real time. And finally, maybe another key element is really, as I mentioned, because it's so important to have that communication participation, that community's participation, it's really to be able to strengthen national and local civil society organizations so that they can advocate for sustained health funding, but also hold our governments accountable.
Well, thank you, Yacine. Very useful points around the question of, community approaches and being able to use data and working with multiple sectors and community civil society. So thank you for that. Do you want to share, Youssoupha, she's pointed to Senegal as an example. Do you want to share your thoughts on that question of, what COVID's done and what are the opportunities?
Thank you very much.
Yes,
hi to everybody. Thank you, Yacine. You have pointed out so many very important information. And we should say from Almata to Astana, following this, COVID-19 show a lot about primary healthcare, the importance of primary healthcare in our countries in general. Just an image, before COVID-19, when some people were ill, they was able to go to Paris, to New York, wherever. In terms of equity and access to health, during the COVID-19, the borders was closed, and we remind everybody that we need to have strong primary healthcare, system. People were treated where they were living in the same city according to their clinical status, not according to their wealth or wherever. So it remains to everybody, and with the commitment of the head of state, that we need to put more resources in primary healthcare. We talk about that later, and about investment plan and all these issues. The power of communication, as she said, Senegal was having a very good network, but with the COVID-19, health promotion was coming up. Other people not involved at the early stage of this came up, like the universities, like private sector, around the community network, which was strong because we have what we call the Bajanigo or the community health worker networks. The communities were very, very much involved, and they even bring more money than expected earlier. This helped Senegal. I'm not talking about the clinical part because we don't have enough time. We put in place like 52 treatment centers around the primary healthcare system to take in charge these people, and this gave very good results. We don't have enough time, but it's important to talk about the opportunity because everything was not successful, was not bright, and we have to think a lot about the digital health system. We need to think about, in terms of primary healthcare, how to develop the e-consultation. We have to do more about that. How we regulate, we're gonna regulate the patient, the tele-regulation, e-regulation. How we gonna communicate more and better through multimedia. So how to involve more departments, more, other stakeholders in communication. We need to think about the health system strengthening, because we learn in the primary health care we need to upgrade our health system in terms of strengthening it, in terms of integration of program, because we did it with COVID, we can do it later. Like an example, oxygen is being upgraded in our country, but it's gonna help for pneumonia. It's gonna help for everything else. Training as well was, integrated during the COVID-19. We need to do more. And we can't talk about primary healthcare without talking about the vaccination as health prevention, and things are being done, but we need to learn a lot more about the power of communities, and we need to think about the surveillance of essential services for upgrading the primary healthcare. We have opportunity to talk about later.
Thank you very much, Youssoupha. I think that, you point out, I think the point that Yacine made about equity is not only across countries, but it's within countries as well. That the rich realized, well, our wealth isn't quite counting, which I think is a very useful point in advocacy that we need to help with. So I think, as you said, primary health care became important. And you saw communication and communities being quite part of that. And then health system strengthening went hand in hand. So we need to actually speak to that. How do we make a complementary cycle in terms of primary health care and health system strengthening where the need is? And I think you've pointed to opportunities with digital health. And I think there are opportunities like we are having this meeting. One wonders whether we're ever going to get really back to the usual meeting we have when we think about all the costs and inconveniences. But thanks, Youssoupha. Perhaps Belinda, you could talk to the question of your thoughts on those questions. What's COVID done to PHC and what are the opportunities?
Okay, thank you,
Belinda, I think you might need to unmute.
Can you hear me now?
That's it. Thank you.
Great. So thank you, Shabe, and hello to everyone. I'd like to continue from where my fellow panelists have left off, because indeed, as they were talking, I realized issues are very similar across the continent. And to start with, I think of COVID-19, unfortunate as it is, I like to think of it as a proof of concepts that PHC is what people need to keep healthy. Because for once, communities realize that keeping healthy is not just about going to hospital. It's about the health education we give to people to get vaccinated. It's about the education we give to speak against the misconceptions that were there and to educate people on the prevention protocols. So if there's one time that we've had an opportunity of a real life proof of concept for PHC, it is this COVID pandemic across the globe. So having said that, the ways in which PHC has been relevant in Ghana across the entire scope, from surveillance through contact tracing, the messaging out there, the kind of community structures we are having, all are linked to our PHC system. As some of you may know, Ghana really, our strength is our community-based health systems, which we call the CHIPS concepts. And when stigmatization issues came and people didn't even want to test for COVID, when all the misconceptions about vaccines are coming out, the structures we are using are the community level structures, the traditional leaders, the church leaders. And all these is happening because over the years, we've taken time to build these community structures that help us to deliver our primary health care. Beyond that, though, there's some opportunities that have been created in addition to some that have already been mentioned. I'd like to highlight the awareness that we just don't need to improve geographical access, but we need to improve the quality. Because once COVID happened, we realized that we were challenged with the requisites skill sets, anesthesiologists, etc., to manage the critically ill. So conversations came up and the government assured the country is going to set up district hospitals, which are the apex of our primary health care, which we lack in about 88 districts in the country. So that threw some light on the need to also highlight not just the quantity of primary health care offering facilities, but also the content of it. That was one aspect. The second opportunity I have seen is also the space that has been given for private sector participation in PHC. Hitherto, private sector facilities is just primary care. They are not very much bothered about providing data. They are not bothered much about the preventive issues like immunization, etc. But as COVID came, as we're challenged with diagnostic, capacity, one of the sectors that have supported most in Ghana is the private sector, to the extent that recently we have one of the biggest private sector facilities dedicating one of its hospitals entirely to COVID management when we had the second upsurge. So that has been one opportunity coming out of it. And finally is the journalists. I think we are realizing some allies that we haven't used to full capacity. So the interest in COVID, the information, the dashboards on the various media houses, I think if we can harness that as we go on, that's one way we can strengthen PHC going forward in our countries. Thank you.
Thank you very much, Belinda. I know it's tight, it's difficult to share thoughts, and I'm sure you're bursting with lots of them. So let's see if Esther has something quickly to share, and before we move on to the poll, but Esther will come back and give you more time later. Esther, go ahead. Do you want to share your thoughts as well? And you've come from the evidence for action kind of campaign. So what do you think are the opportunities and the challenges with PHC at the moment?
Indeed, I would say that there are opportunities that were created or that were thrown out by COVID-19. And you find out this in the sense that the PHCs in Nigeria, if you look at it, is the weakest link you can think of. And it was really ill-prepared to address this pandemic. But one thing the government rose up to at the federal level, they put in place a very comprehensive guideline to address COVID, to help the primary health care system to, detect, to respond, and then in a collaborative manner. And so you find out that there was, in implementing that strategy or that guideline, of course, the entire PHC system stood to gain from it because you're strengthening the structures, you're strengthening capacity building to address it. So in the process, at some state level, we even found out how governments were now making free access to safe deliveries, access to emergencies to be treated and responded to. And so generally, there was this increased resources being pushed out to the health system. And so these are opportunities I strongly feel that as advocates, we should sustain and ensure that they they continue to provide that resources to the primary healthcare system.
Thank you. Thank you very much, Esther. So just to quickly capture before we go on to the poll, I think, Belinda, you mentioned, the question of access and quality being quite the issue, I think, like you said, and governments are interested, Esther, as you said, in building stronger access and putting resources behind it and seeing primary health care as the solution. And I think you saw important opportunities with the private sector and media, Belinda. So I think these are useful statements that have come together, very useful ideas. I please want to urge all of you, please feel free to put in questions into the Q&A. But right now, I think we go over to the poll, which you have right in front of you. Please feel free to add your thoughts and in terms of the questions, and then we'll just see the results very, very quickly. So just very briefly, while we're busy with the poll, I think the next session is, or the next few minutes is actually about us trying to explore ways in which you can learn advocacy from the experts around the table and find ways in which you could use advocacy to hold governments to account. So it's a teaching, it's an opportunity to learn, and each of our four panelists will provide us some answers to some very basic questions. The questions will be, what are key elements of an effective advocacy strategy, and how might governments shift resources or support PHC? So I think one needs to understand that. And also the last one, which we're going to look at, is how can multilateral organizations and stakeholders outside of Africa help support PHC advocacy in Africa? And I think that we'll get that from it. So, and I think the last question is about in-country advocates. What can they do? What is the most useful thing they could do? So we hope our panelists will provide you great insights. we can then move forward from there. So let me see if we got some answers. So here you have it. It seems like, is PHC playing a role in the COVID response? It's really great that it is predominantly yes. I mean, there was a serious risk, and I think that's what somewhat and no means, is that PHC could easily be marginalized with, with the hospitalist care that COVID and ICU tends to attract. I think that barriers to investment, I think political will is certainly there. Budget constraints, we should ask ourselves, is that not political will as well? But I think that's an important idea, that it really is at high level, and these are the people we need to talk to. I think what is the one thing your country can do? Engage communities in decision making. I think it's absolutely spot on. And instead of engaging communities and just talk, we should actually find small ways in which they see benefit for this conversation. So let's see what our panelists have been able to, will be able to suggest. So let me go over in our panel to ask the following questions. Like I said, Yacine is the founder and president of SpeakUp Africa, focusing on strategic communications, policy, and advocacy. Yacine, what are the key elements of an effective advocacy strategy? And if you just manage time with me, but Yacine, go ahead.
Yes, I'll do my best to synthesize as best I can, even though
Please.
I probably speak for a very long time. But maybe just to summarize it quickly, I think our approach at SpeakUp Africa is very much based on three pillars, which the first one is around capacity, to really ensure that we're strengthening capacity of our partners and our stakeholders to be able to impact health outcomes. The second one is really around collaboration, which is to promote existing avenues for cooperation and create new ones if there are gaps that have been identified. And finally, around codification, which is really working together to make lasting, sustainable change in policy and advocacy, and really resource mobilization more broadly. And to do so, we use a diverse toolbox of advocacy approaches, which I've summarized in a few categories. The first one, again, around capacity building. The second one around coalition building. The third one around public mobilization. The fourth one around information campaigning. The fifth one around decision maker engagement, and finally around policy monitoring and evaluation. And depending on the local context and what the needs are, several, all, or none of these approaches can be used. So it's very much tailored to local context. But the idea is that the outcomes are really to have a strengthened local civil society organizations, impactful and integrated alliances, being able to increase private sector engagement, have more integrated policies and approaches, and really have enhanced accountability across the whole ecosystem. And maybe just an example around some of the campaigns. One that we've had that we launched right at the start of the pandemic was the Stay Safe Africa campaign. And the idea there was that we recognized that there was a huge risk with the pandemic presented to the health systems, and that we needed to respond. And so we brought together partners under a neutrally branded campaign to really be able to ensure that we were providing communities with simple, proven preventive tools, but that we were also bringing together multiple partners from multiple from multiple sectors, as well as looking at how at a country level we could also work with in-country partners to really be able to deliver what was needed in the countries. And I really cannot reinforce how important that element is in any type of strategy that's developed. And then
Wonderful.
Two additional points. One is around maybe an initiative called African Voices of Science. And there again, we felt it was important as part of our work to also ensure that we had leading African scientists that were sharing their opinion in order to really be able to use their voice to for communities to really be able to understand what is happening, especially as we're looking in the current pandemic context with the vaccines, as well as really looking at how we can further champion African science. And finally, with respect to the youth, we thought it was important to really look at how we can foster innovation around youth. And this year we launched the African Young Innovators for Health Award. And the theme is for the young people to develop innovations that support community health workers. And that, of course, is critical to the conversation we have here today.
Well, it's great work that you're doing, and I'm sure that people will just Google SpeakUp Africa and find a lot more of the information you just talked to. So thank you for sharing that. Let me move over to Esther. Esther is the Senior Health Financing Advisor and Deputy Country Lead for Evidence for Action, another advocacy person with lots of skills. What are your thoughts on an effective advocacy strategy, Esther?
Yeah, thank you, Musa. Like Yacine had mentioned, a lot of those strategies exist: capacity building, monitoring results, prioritizing and identifying the issue and prioritizing it. But for us, three things have really stood out working with our coalitions, which we call the state-led accountability mechanisms. One, identifying the issues and prioritizing the problem, monitoring results and engaging in dialogue with policymakers. Also, building in networking and collaboration. So I tell you, for instance, in 2018, we successfully advocated and got a budget line that would fund commodities, sorry, not commodities, consumables for family planning. And that budget had been existing 2018, 2019, 2020 was fully funded. But you know, with monitoring, you see that in 2020, the budget was released was zero, as against 2019 that 98% was released. And I'm talking about primary healthcare right now. This money was directed at primary healthcare facilities. And so zero was released. And then if the people didn't go into monitoring for results, you won't have that evidence with which to engage with. So it's very important that when you have these successes in place, you constantly monitor the results. And what else works is the networking and collaboration. So within the state-led accountability mechanisms where we have our coalitions building, we have different kinds of partnerships within them. We have the civil society, we have the media who amplifies all of this evidence that comes up. And so you also have the government officials working in there as well as other CSOs. Now they have come together to decide and say, what are we going to do with these results that we found out? And so they are engaging in dialogue. And sometimes you find out that with this sort of results, you don't even need to go on high level advocacy because already you have identified some of those focal persons who can, through your bottleneck analysis, who can then respond to these issues. So like what we say in Africa, if you want to go fast, go alone. But if you want to go far, go with others. So we really emphasize on networking and collaboration, because with that and with the government officials even seeing these results, they are happy to make those changes. Now, there's one thing also that sticks out. It's neither here nor there, but it's about trust. Within the government must trust your data. You must be a credible partner to the government. And so you must be able to demonstrate that the data you are using, of course, which the E4A program, we hone in on the DHIS, which is the government's data portal. Use that evidence, interpret it, and then enable them to take actions around that. Thank you.
No, thank you very much, Esther. I think, both of you have pointed to the question of collaborations, coalitions, and engaging with key decision makers, especially with data. I think importantly, we've got to look at the question of how do we engage the public, and also how do we build capacity around the table for you to advocate for primary health care. So I think here's some great resources, and I'm sure that you can touch base with them in taking this forward. So let me proceed, and I think we can come back to this question, about details around advocacy. Let me ask the question of Youssoupha, who's the Director for Planning, Research and Statistics at the Ministry of Health and Social Action in Senegal, as well as Belinda, who's a public health practitioner, but a former Director of Information in Monitoring and Evaluation in the Ghana Health Service. How do we shift resources and to support PHC considering COVID. What's your experience and your insights that you'd like to share? Perhaps Youssoupha, you could start.
Okay, thank you very much. I mean, to be honest, we should just realize we don't have the choice. Before COVID-19, if we use the PHCPI pool we work with, we were about 7% of domestic resources to primary health care. But if you take the health accounts, we are less than 5%, which is very, very low. And then we should think about two aspects. One is, I mean, the non-financial, even if there is the financial impact, because somebody should pay at the end of the day. And we learn, we have this, what I can call the immaterial thing. I mean, like the community, we have a lot in terms of shift, because the potential in the community is not highly used. And COVID-19 show we can do more with the community, and then they can have more impact in terms of resources. I mean, at this level. And Senegal did this. At the time is very short, but I say Yacine could come again on that. We have as well, I mean, local initiative, as we say, through the community, but local authorities, they did a lot. And there was resources which was like sleeping somewhere, and they just wake up. And this was very, very important. The private sector did it as well in general. But we have financial issue as well. Talking to the community, I would show they did a lot about contact follow-up. Very, very important, contact tracing and those aspects. The financial issue was very, very important. There was a shift, very important shift. I was saying 7%. We're gonna calculate how much now. Because based on the contingency plan, the government of Senegal put $2 billion in general. Local authority, $10 million. Private sector, about $3 million. Technical and financial partners, I don't have the right spending at this time, but this helped a lot to involve in primary care. And to finish, there are some investment like in social protection, which have an impact on primary care. I would say about having food, giving security, housing, water, communication, all these dissemination were very, very, and they was highly improved during the COVID-19. Thank you so much.
Thank you, Youssoupha. Belinda, Esther, Belinda, do you want to respond as well? And then I can just frame those comments. How can we support primary health care given COVID?
So I think the first thing is to realize that there's competition out there. That's the fact. And you can't have these resources by default. You need to think like a politician. Maybe that's controversial, but I had an experience when I was once a district medical officer of health, and I was dealing with a politician who had access to resources, but was only sending it to a specific part of the district, primarily because the other part, he comes from that part of the district, and the other parts were seen as settlers. All it took was to go to him and say, well, although they are settlers, they are 60% of your voters. And we were able to get a health facility by finding out what was important to that politician, which at the end of the day was the votes. So when it comes to the primary healthcare movement, it's the same. I think it would take us being able to package our issues and finding people with that skill set to help us market what we are marketing. Otherwise, we may have all the data, but the people who hold the purse, who need to make the decision, might not be able to relate to it, or it's not very important to them. So I think it's important to think like a politician and to find out what is important to the people who are holding the purse, and also to get people to agitate. I'm sorry, I think
nope, absolutely spot on.
Yeah,
don't apologize.
Yeah, okay, thank you. Governments don't give out things by default, you know. They give out things, they allocate budget because people agitate. So one of the things we did last 2 years when we were working on our primary healthcare policy was that we created room for the private sector to lead some of the engagements. I tell you, some of the hard truths that were spoken during that engagement some of the media, publications that came out, if that was led by those of us in the government space, those hard truths wouldn't have been spoken. So beyond the issue of thinking politically, it's also about creating spaces and finding allies who can say the things you can't say if you are sitting in the government sector. And finally, to see our communities as not just users of our services, but people who can contribute. I think Youssoupha mentioned that, and we have seen that a lot through our community scorecard process, where communities come back, give us a feedback on the service we are providing, and you will be amazed some of the challenges they identify, which is similar to the Mamaye E4A process. They are able to actually make contributions to improve their service delivery. So in terms of advocacy and how we can, mop up more resources to the PHC space, these are some of my thoughts. Thank you.
No, thank you very much. I think really provocative thinking, and I hope that people will say this is agitation class, how we agitate populations of Africa. It is. I think that what you've said, and Youssoupha has also said, that is communities will respond. They do things, and we need to respect that they will try and address their problems as best as they think. And I think that we do need people with data, people with information, but we need to understand that it's communities and the power brokers, and we need to find ways to mediate that. As you say, we need to be politicians to really understand power. And power doesn't only reside in the formal spaces. There's power even in the gogo who sits and does nothing, but is able to speak very articulately in a ward meeting, when her politician comes, and then suddenly things start changing. So we need to understand power resides everywhere. So let's just quickly go through the last two questions, and perhaps I'm going to rearrange it and ask, the sort of in-country advocacy. What do you think is the most important action, Youssoupha, that being in country that you would be able to do to get investments in quality primary health care? What do you suggest to colleagues around the table today? And the same question for Esther. What are your thoughts? What can we do to try and make that happen? Youssoupha, do you want to, or Belinda, do you want to go first?
Well, I could jump in.
Yep, go ahead, Belinda.
Oh, no, I think Youssoupha is already on.
Okay, Youssoupha, go ahead. What is the way to get investment in primary health care? You want to know the question again? Do you want me to repeat the question?
Yes, please.
What would be the most important action that advocates in Africa can take to get long-term investment in quality primary health care? What do you suggest they do? How do you think that they should go about getting that happening, investments, long-term investments in quality primary health care? Just your thoughts around that.
Yeah, very important question. We need to go from the bottom, because we need to, what are the, what in French we're gonna say, les prérequis. We need to work on having currently at any time the diagnostic of our situation. We can do it, we should do it through strategic documents. Like in Senegal, we were lucky to have a new 10-year plan, which was thinking about if it happens, we have like outbreaks or something like that. We had as well at the same moment like a financial plans, strategy, national strategy for health financing. That was very, very helpful to build action plan when COVID happens in China. Yeah. We need this. To have a long-term plan, we need to have an investment plan based on gaps. We were lucky to have this investment plan because just before, after the COVID-19 happening, we put in place an investment plan, invest a long-term and mid-term plan for at least the 5 coming years with the finance that we need. We need to identify the key stakeholders in this puzzle. It's very, very important. And we don't forget those who don't bring money, but those who bring, this is a matter. I was thinking about the communities, and those who bring money as well, the private sector, the gender and multi-sectoral approach should be considered The civil society is very, very important. So all stakeholders need to be considered in this system if you want to have a long-term, issue in a long-term plan. I want to talk more time about health system strengthening. That's the key.
Yep.
Because it's matters of efficiency. So we need to integrate all you're doing, but as well research. Because decision in terms of primary health care should be taken by evidence. Research is less than 1%, 0.5% in many countries in Africa. We need to do more. So we need, at this time, we're gonna take, take decision based on evidence. We don't have enough time, but I would talk about health promotion. Health promotion is very, very, we don't have enough money to treat cancer, to treat whatever about, non-communicable disease. We need health promotion, and to finish, we need health collaboration. We learn from COVID. We need mathematicians. We need to modelize what we are thinking about. We need social scientists. We don't have enough social scientists. We need all this. There are a lot. I'm not exhaustive, but time is very short.
I think, clearly you've got lots of ideas.
Very, very important.
Yeah. And there's a lot of subtleties in what you've just said. No, thank you. And I think, Youssoupha, you have lots of subtleties that you raise. And I think that anybody who wants to really grab this should in fact listen to it again. So I think you brought up lots of issues, but I'll try and recap them. Esther, if you want to share your thoughts on what, advocates in Africa can do right now to get this investment in quality primary health care.
Yes, please. For me, what we need right now is sustained active citizen engagement. And this has to be from, like Youssoupha said, from the grassroots. Communities have to be involved in this advocacy. And advocacy has to be at different levels, civil society, at the federal level, and then they must speak one language. Of course, how to get this out? The social media, we must all be active on the social media and traditional media. Now, from one of our sister programs in Kenya, this is what we did recently. Now we got the grassroots community for the first time to be engaged at the public participation of the budget process. And now how were they able to engage? They were able to engage because we have built capacity in them. They were able to analyze the county's strategic fiscal paper that came out based on the priorities they were looking out for and the gaps. They were able to put up a memo. And for the first time, they were able to sit on a stakeholder platform. Now, they weren't invited to that platform. They got themselves invited because they had something to say. And they spoke in their own language to tell the government. Government is to invite only implementing partners. But for this time, they had to bring them in because they knew that they were prepared. And so on the part of communities and grassroots involvement, they have to also be prepared. And how can they be prepared? By building their capacity and understanding the issues. So we have to let them understand the issues in their own language so that they can participate effectively. So in the wrap, effective citizens' active engagement is important to sustain all the gains we have gotten through COVID-19. They have to be engaged from the planning period. That is where the budgets and resources are being allocated. They have to be engaged in managing those budgets. They have to be engaged in ensuring that when the results come out, they dialogue with government to ensure that these gains are sustained.
Absolutely.
Thank you.
So thank you. So the advice for advocacy is basically the same kinds of ideas are popping up. How do we go bottom up, engage communities, and then try to get evidence and information to bear, to support that engagement and actually help the engagement of lots of stakeholders, media, as well as those making strategic plans. I think Youssoupha pointed out, the question of finance departments and finding ways in which the evidence can show the gaps and find ways in which, a lot more of the subtleties of primary health care can be brought to bear in those discussions with key stakeholders. So let's move on. We don't have terribly much time, but the last question, and I'm going to pick up on the conversation, What can multilateral organizations, those outside, how can they support PHC advocacy? And I don't know whether Yacine, Belinda, you want to respond also to the comments made about being politicians. If you want to be an advocate, you have to understand power. Yacine, you want to go for it, and then Belinda.
Yes, absolutely. I'm happy to start. I think it is critical for everybody to be effective advocates, to understand the political environment in which we operate and really be able to use the arguments that are needed, and most importantly, that we know will work on the policy makers that we're trying to advocate towards. And I think when it comes to primary health care, what's important is really looking at how stakeholders, understanding how important the role of multilateral organizations and stakeholders outside of Africa are, and the critical role that we would want them to continue to play by providing some of the essential tools, funding, and innovation. But at the same time, I think this is where it's critically important, is for us as African organizations and voices to be able to play a leading role in the process of developing the primary healthcare agenda, and really being able to create those African-led policies and programs that we critically need for our growth and development. And most importantly, to be able to do so, we need a seat at the table. So really looking at how we can provide the appropriate platforms for our civil societies to be able to not only participate, but meaningfully engage and be able to address some of the policy bottlenecks that we've seen, as well as bring together some of the priorities that have been identified in the ground.
Oh, thank you, Yacine. Belinda, your thoughts on that? I think importantly is, people need to support Africa-led, engagements around advocacy. So that's the message to people outside. What are your thoughts, Belinda?
Yes, I associate with all those sentiments Yacine just shared. Addition to that, I think that it's very critical for the big funders that fund some of these vertical programs to realize that it's important some of those resources are shifted into PHC, because if there's anything we've learned from COVID, it's that you need a system to function for the response and to these specific diseases to be adequate. So I would like to applaud the efforts of organizations such as the Bill and Melinda Gates for the Resilience and Sustainable Health Systems grants, which typically aims to strengthen health systems in the countries that benefit from this grant. So we'd like to see more of that. I think it's also important that they create, I think I'm big on creating spaces, because there's nothing like a lived experience. When you have these organizations and they lack leadership and people who have really are very knowledgeable and understand these terrains they seek to do good in, then you are missing out on that opportunity. So yes, to African-led advocacy groups, and yes, to seats on the table for people who have lived this experience, and it's not just theoretical for them, and can help them enrich the packages they seek to deliver. And finally, they should support research, particularly implementation research. I think Youssoupha touched earlier on research. But one of the things we are dedicated to doing is our implementation research, where we try to figure out how to do things. So it's not enough having the interventions, but also how do we roll out those interventions? How do we scale them up in the local context that we work within? And PHC, if it will be people-centered, it will be focused on the needs and responsive to the needs of the people. We need to get that part of the equation correct, where we understand how to deliver services more efficiently.
No, thank you, Belinda. I know that I haven't given enough time to Esther, and I missed you somehow, but Esther, any thoughts on any of these issues in closing? Hello, Esther? I think you are muted. Ah, right, there you are. Go for it.
Yeah, in closing, I would say that, yes, we need advocates in Africa. We have these advocates. We need to strengthen our advocacy. We need to back it with evidence. We need to speak louder. We need to engage government. We need to plan with them, most importantly. And so before you get anything out, you must plan with them. So it's not when they have finished planning, you come to say that you want resources to be allocated to this. And you must create a compelling case. You must have a cost tracking the budget, but also what does it say practically? So what are the service delivery performance issues? How does it impact on people? So if you are doing, for instance, MNCH, maternal and newborn health, what are the indices? What are the statistics? Can you bring that compelling case with the financials and the funding? What is it saying? And then place it at the doorstep of government. Of course, with sustained advocacy, we know that whatever gains we have made, we would be able to keep them. But if we advocate today and go to sleep tomorrow, then be rest assured that those gains will disappear. Thank you.
No, thank you very much. I think you've captured it very well. And, you know, it's really a very useful sum up of all the issues that one needs to, as an African advocate for primary health care, to take note of. So tell me, thank you very much. I think we'll wrap up now. There are some few questions, and thanks to George Kimati for answering one of them. You're free to respond as well. There are two questions, essentially. One is, how do we engage vulnerable populations by those who are most impacted by COVID in PHC advocacy? Any thoughts? I think you can see the response by George, but any thoughts on it? Any other responses to that question? George has suggested that work closely with specific groups, those, I think, the specific marginalized groups, to understand the issues, which I think is really exactly what everyone has talked about, because the majority are actually marginalized by politicians, by decision makers. So I think it's exactly what you've just said, would work just as well for any marginalized community. One needs to just seek them out and know about them. There's another question that is there, and which is a question, I'm not sure that it's from the chat box. Should specific subspecialized training be emphasized for the doctors to be, keeping in mind the pandemic, or training in school and specialization be left as is? So I'm not quite clear about the question, but I think it's about, should we be advocating subspecialist training in hospitals given COVID? Anyone who wants to respond? I know I would say, no, but you're entitled to your opinion. So anybody would advise that. So go ahead. Anybody would like to respond?
Hello?
I mean, the need for us to have subspecialties and specialties. Youssoupha, go ahead.
Thank you. I sent a text, but I would say from, I mean, the small experience I have on that in the country. At the beginning of the epidemic, of the endemic, we were just focalized on having more anesthesiologists, because people were dying from that, and we did everything we could to have it. But in the meantime, we just realized even in anesthesiology we had other problems that were shown by research. So people were dying from this or that. And the thing is, I mean, we realize we need more research at the end of the day. We need more prospective research so as to make sure we can take in charge our patient. But in the fact, we decide to have more anesthesiologists, and we are planning to recruit a lot of them. We need to have in COVID, epidemic, more radiologists. We are working on that. But in a better way, we realize we need to reinforce the capacity of those in charge of general medicine and the nurse and the midwife as well. Because some aspect of this specialty need to be sold to them. At the end of the day, we just realized, I talk about We need to have social scientists and other specialties which are not from medical, but in terms of public health, in a way to better take in charge our next epidemic or pandemic. I hope it's going to be in 50 years' time. Over. Yeah. Thank you.
No, thank you, Youssoupha. And once again, thank you to this panel, to PHCPI for facilitating it. Thank you very much, Yacine, Esther, Belinda, and Youssoupha. Great insights you shared. I hope that all of you have enjoyed it. Please don't forget that there is a session which you should be going to from now, which is the closing session and award ceremony. I think it's in the group. Please join that. And thank you all for joining us in this afternoon. And power to you. Please advocate for primary health care. Take care, everyone. Bye-bye.
Thank you very much, Xavier, for your great moderation. Bye, everybody.
Bye-bye.
Bye.
Bye.